This is for educational purposes only. No copyright infringement intended.
Darker and darker. Okay, alcoholism. Page 4, alcoholism. We're going into some psych and some med-surg both with this one. I want to talk about the psychological aspects of alcoholism, called the psychodynamics. The number one problem in alcoholism psychologically is the same as the number one problem in any and all abusive situations. The number one problem in abuse is denial. Denial. Abusers have an infinite capacity to deny. In fact, an abuser has to deny in order to continue the behavior. Because what does denial allow that abuser to do? Keep doing it without having to answer for it. They just deny they have a problem with it. Now, I want you to understand, the title of this lecture is what? Alcoholism, but this first part is you can use the alcohol rules for any abuse. So what's the number one psychological problem in child abuse? What's the number one psychological problem in gambling? What's the number one psychological problem in cocaine abuse? What's the number one psychological problem in spouse abuse? Elder abuse. Denial is the number one problem in all abusive situations. Why is it number one? How can you treat someone that denies they have a problem? Right? So until they admit they have a problem, you've got a problem. Okay, definition. A, definition. What's the definition of denial? It is refusal, that goes in the first blank, refusal to accept the reality of a problem. They refuse to accept the reality of it. They say, I'm not an alcoholic. I can quit any time I want. I'm not a spouse abuser. We just have a really physical relationship. I'm not a child abuser. I'm just a really strict parent and my kids aren't spoiled. You see what I'm saying? I'm not a gambler. I like games of chance. I'm not a food abuser. I'm a gourmand. You know, they have all these denials about their problem. So how do you treat denial? Letter B. You treat denial by confronting it. You confront it. Confront. You confront it by pointing out to the person the difference between what they say and what they do. So how you confront someone is this. You say, okay, you say you're not an alcoholic. It's 10 o'clock in the morning, you already drank a 6-pack. You know what I'm saying? You just confront them. What did I point out? The difference between what she said, which was what? I'm not an alcoholic, and what she did, which was drink a 6-pack before 10 o'clock in the morning. You say you're not a spouse abuser, but she has a restraining order against you. You see the confrontation? You say you're not a child abuser, but Protective Services has your children. You see, you say you're not a food abuser, but you're 400 pounds and you're 5'1". Do you see what I'm saying? It's my thyroid. Okay, it's your thyroid. But the point is that they will deny what they have, and you confront it by pointing out the difference between what they say and what they do. That's confrontation. Now, don't get thinking that confrontation is the same as aggression. Don't get those two things mixed up, because aggression attacks the person. And aggression says, you are too an alcoholic, you jerk, you have to admit it. Do you see, what did I attack? What did I attack? Her. You, jerk, admit it. When I confronted, did I attack her? No. You what? Say you're not an alcoholic. That's sorry. Okay, you say you're not an alcoholic. Did I attack you? No. No, I just said you say you're not an alcoholic, but it's 6-pack gone by 10. I mean, you're just saying, hey. You're not saying right, wrong, good, bad, horrible, wonderful. You're just saying, hey, this is what it is. This is what I see. You confront. So don't get confrontation mixed up with aggression. Aggression attacks the person. Confrontation attacks the problem. On boards, never attack a person. Just another little note. They have these questions where you're interacting with staff, and they'll say something like you're dealing with a staff nurse that has more seniority than you on your first job, and they just find fault with everything you do. You understand the scenario? Well, how do you handle that? What do you say? Does anybody know what you say? What's bad to say? And think about pronouns. What pronouns would bad answers have, and what pronouns would good answers have in that scenario? You versus I. So explain that to me. What do you mean? What's the good? What's the bad? The good answer has what in it? I. Bad answer has you. So what don't you say there? Why don't you like me? Why are you so mean? The right answer is, I seem to be having I seem to be frustrating. I seem to be having a problem, or are seeming to not get along well. You see what I'm saying? Always, when you're dealing with psychodynamic problems with staff, use the I. I'm, not you. Do you understand that? That's a real big thing they are testing a lot now. Okay, same thing with positions. Positions, when you question them on the phone, don't say, you wrote the order incorrectly. You say, I'm having a difficult time interpreting exactly what you want. Do you see the difference? Okay. So, when they are in denial, what do? Confront. Deny, confront. Deny, when you link that in your mind. Deny, they deny, you confront. They deny, you confront. However, be careful, because there's another place where denial is operative, and that is loss and grief. Don't people go through denial and loss and grief? Have you heard of those stages of death and dying, loss and grief?
Yes.
What are they?
DABDA.
DABDA. D-A-B-D-A. D-A-B-D-A. Denial, anger, bargaining, acceptance, depression, acceptance. Denial, anger, bargaining, there's your DAB. And depression, acceptance, there's your DA. DAB. So, denial is an accepted, healthy, normal first reaction to grief and loss. So what do you do for the denial of loss and grief? Do you confront it? What do? Support it. The word is support. You want to support it. So my point is this. When you get a patient in denial, what do you have to pay attention to get the question correct? Is it loss or abuse? Is it loss or abuse? With abuse, you what? Confront. With loss, you support. I live in Cedarville. It's college of 3,000 in a town of 3,000. So there's one student for every person in the town. But we were basically a farming community with a college, and we have a lot of one-handed men in our town. Why? Baler accidents. The balers amputate their hand. So we have a lot of farm machinery, one-handed baler accident guys. Can you imagine a farmer comes in, his hand gets amputated, and it's all wrapped in a bandage. The next morning, you're taking care of him, and he says, I can't wait to go home and play piano. Problem. He only has one hand, right? So he's in what? What is he refusing to accept? The reality. Is that denial, refusing to accept the reality?
Yes.
So he's in denial. What would you never say to him? You say you're going to play piano, but you only have one hand. That's called what? Confrontation. Now, is confrontation okay for denial? Yes, as long as it's abuse, but not if it's lost, and this guy is lost. So what do? You say, oh, well, how long have you played piano? What's your favorite kind of music? Did you take lessons? What are you allowing that denial to continue? You're supporting it because it serves a function. Is everybody getting the difference? But if you got an alcoholic says, oh, I'm not an alcoholic, I can quit any time I want. He's in what? What's the strategy? Confront. What would be really horrible to do? Support. You wouldn't say, oh, how long you been drinking? What's your favorite beverage? Did you take lessons? Did you ever go to have that, hurricane over there at, MacGyver's bar? You don't support it. So you see where you got two totally different answers for denial. Just pay attention to that. Okay, let's talk about the number 2 psychological problem that abusers have, and that is dependency, codependency. Dependency is when the abuser gets the significant other to do things for them or make decisions for them. In other words, the abuser says, oh, would you call my boss? Would you go do this? Would you do that? And they do it. So who is dependent? The significant other or the abuser? The abuser is dependent. Now, codependency, on the other hand, is when the significant other derives positive self-esteem from making decisions for or doing things for whom? The abuser. So the abuser says, call my boss, tell him I'm sick. That's an example of what? Dependency. The significant other calls the boss, says he's sick, he can't come to work. Hangs up, says, oh, aren't I a wonderful spouse because I did that, because I don't know anybody else who would do it for that jerk. What are they? How do you know they're codependent? Did they get positive self-esteem? Yeah, what did they say? Oh, aren't I a wonderful spouse because I did that? See, they have this rather pathologic yet symbiotic relationship. One is dependent, the other gets positive self-esteem for meeting those dependency needs, and they just feed off the other. What does the abuser get out of the relationship? What does the abuser get out of the relationship? What's that?
Just keep doing it.
Yeah, a life without responsibilities. He gets to keep doing whatever he wants, abusing. What does the significant other get out of it?
They feel good. They feel
positive self-esteem out of it. And then we sit there and we say what to the significant other? Leaving. What are you doing in that relationship? Get out of it. Right? But they can't get out of it because what's tied up in that whole thing? Their self-esteem. So, it's really kind of tough to treat. Well, then how do you treat it? How do you treat it? Well, number one, you set limits and enforce it. You set limits and enforce them. That goes fill in the blank. Set limits and enforce them. In other words, you start teaching the significant other to say the 2-letter word, no. And then they have to keep doing it. Will you call my boss? No. Would you go buy me some? No. Would you drop me off at the track? No. Would you get me a ham sandwich out of the refrigerator? Well, see, that would be okay. I'm not saying say no to everything. I'm saying say no to those things where you're feeding into everything. All right? But that's not good enough. That alone will not work. Because you must work on the self-esteem of the codependent person, or it will never work. Because as soon as the codependent starts saying no, what will the dependent abuser start saying? You don't love me anymore. You're a mean, nasty old whatever. Because you are just horrible. You're horrible. And what's that person playing right at? Self-esteem. They know what side the bread's buttered on. And they go right at that person's self-esteem, and within 10 minutes they got them emotionally manipulated right back into the whole system. So in order for this to work, what does the codependent person have to say? I'm saying no, and I'm sticking to it because I'm a good person because I'm saying no. Oh, you're nasty. I don't care what you say. I'm a good person. And that's how you have to work on it. The thing is, I worked at Lafayette Clinic in Detroit, Michigan for a couple of years, and it's mostly alcohol rehab and seizure. And we found that when we treated codependency, dependency successfully, when we treated this problem, guess what we lost? The relationship. You know, the codependent person would go, I'm a good person, I don't need you, and why am I here? And they'd leave. So, you know, we'd solve the problem but lose the relationship. Real common. Okay, turn the page. Let's talk about manipulation. What's the definition of manipulation? It's when the abuser gets the significant other to do things for him or her that are not in the best interest of the significant other. The nature of the act is dangerous or harmful. What goes in the blanks is interest and harmful. Interest and harmful. So how is this like dependency? How is manipulation like dependency? Yeah, in both situations, the abuser is getting the other person to do something for them. Then how in the world do you tell the difference between those two things? What's that? Well, neutral versus negative. Look at what they're being asked to do. If what the significant other is being asked to do is neutral, no big deal, no harm done, no harm, no foul, it's simply dependency, codependency. If what the significant other is being asked to do is inherently harmful or dangerous to the significant other, that person is being manipulated. So let me give you two examples, and you tell me which one is denial, which one is dependency, and which one is manipulation. A 49-year-old alcoholic gets her 17-year-old daughter to go to the store and buy alcohol for her. That is what? Why? Well, no, because a 17-year-old going and buying alcohol is illegal in the state of Ohio. So it is illegal. So she's being asked to do something illegal. Now, what about this? A 49-year-old alcoholic asks her 50-year-old husband to go to the store and buy alcohol for her. Of what is that an example? Why is it dependent? It's the same thing, buying alcohol.
She's old enough. She knows he has a problem. She's old enough.
I mean, well, and she's of age. There's nothing. How harmful is it for a 50-year-old man to go to a store and buy alcohol? Any harm? No. So that's simply dependency. But when the 17-year-old goes to buy alcohol, that's illegal. There's harm. That's manipulation. Let me give you an example. Tuesday evening, or last Friday evening. Remember Tuesday, last Friday, around here? Okay? Your neighbor calls you, no, your brother calls, sister-in-law calls you and says, would you pick up little Billy from basketball practice at school so he can spend the night at your house because of the snow? Now, you have what's four-wheel drive what? Hummer, Jeep. What's best in the snow? Not ice, the snow. What? Four-wheel drive, some big, okay, you got a big earth mover, four-wheel drive earth mover, okay? And you live 3 blocks from the school. And you say, okay, sister-in-law, I'll do that. You are being what? She is being dependent on you. You're being codependent because you'll say, oh, aren't I a wonderful brother-in-law for doing this, right? What if your sister-in-law calls you? She's got the four-wheel drive all-terrain vehicle. And she lives 3 blocks from school. She asks you to pick up her son and take him to your house. You have a Kia Sophia with bald tires, and it starts every other time. It leaks oil, got no heat. Do you see what I'm saying? And you live 20 miles from the school. And what's happening here? You're being what? Manipulated, because it is inherently dangerous for you to get in that car and go that distance when she could do it easily, safer, better herself. Whereas in the first one, it was safer and better for you to do it than... Do you see what I'm saying? Dependency and manipulation are similar. It's just the only way you tell the difference is one, you're being asked to do something which is bad for you, that's manipulation, versus something that's neutral, that's dependency, codependency. Can you tell the difference now? Okay, good. All right. How do you treat manipulation? You set limits and enforce them. So you start saying what two-letter word? No. Number 2, it is easier to treat than dependency, codependency, because nobody likes being manipulated. I have never heard a person say, oh, I must be a wonderful person for being manipulated. Do you know what they all say? I must be an idiot for falling for that. Do you hear any positive self-esteem going on? No. So there's no positive self-esteem issue going on with manipulation like there is with dependency, codependency. You see why it's easier to treat? Okay, let's just summarize. How many patients do you have with denial? If Bob is in denial, how many patients do you have? 1, 2, or 3, or 4. Bob is in denial. How many patients do you have? 1, 2, or 3, or 4? 1. Bob is dependent. How many patients do you have? 1 or 2? 2, because you got to get the codependent. Bob is the manipulator. How many patients do you have? 1 or 2? 1. Do you see what I'm saying? Because you don't have to do anything with the person who's being manipulated because there's no self-esteem issues. So with denial, you got 1 patient. With dependency, you have 2 patients. With manipulation, you have 1 patient. Does that make sense? Okay. All right. Let's talk now about things specific to alcoholism. Let's talk about Wernicke's or Korsakoff's. Wernicke's and Korsakoff's. Typically, they are separate, but boards often lumps them together. Wernicke's is an encephalopathy and Korsakoff's is a psychosis, but they tend to go together. You find them in the same patient. So Wernicke-Korsakoff's is number 1, psychosis induced by vitamin B1 or thiamine deficiency. This is a scenario where you lose touch with reality. You go insane because you don't have B1. What's it induced? Psychosis. Psychosis, which means insanity or loss of touch with reality. These are psychotic people, not just a little bit emotionally disturbed. These are psychotics. The primary symptom, number 2, is amnesia with confabulation. Amnesia with confabulation. Amnesia means memory loss. Confabulation means making up stories. Why do they make up stories?
I don't know.
Because they forgot. Well, in that case, then I'm psychotic. Because I often make up details that I have forgotten. Right? So then why are they psychotic and me not? Fair question. Why? So everybody that forgets something and makes up a story to fill in what they forgot is insane, psychotic. True or false? False. Well then, explain to me the difference. Why? Why are these poor people called in psychotic and we're not? Because they believe it. See, when I fill in details because I forgot, I know it's not really true. But they really believe it. The lie is just as real as reality. And their memory loss is not, oh, I forgot what I did last night when I was drunk. No. It is, what happened to the 90s? They don't remember anything in the whole 1990s. They'll lose entire decades of their memory. So what will they do? make up stories as to what they were doing during the 90s. I had a guy that, with Bordekees, he was Ronald Reagan's national security advisor during the 80s. The guy had never made it past third grade.